Good afternoon, everyone. I'm Tom Stolz, County Manager, and I'm here today to talk about our Sedgwick County COVID-19 daily update for May 1, 2020. We'll go through the numbers very quickly. In the United States, we went from 1,046,222 cases to 1,070,032. That's a 2.9% increase. In the state of Kansas, we went from 3,959 to 4449. That's a 12.4% increase. In Sedgwick County, we went from 402 cases to 408. That is a 1.5% increase. In the state of Kansas, we have reported 130 deaths due to COVID as of today. Our periphery counties cases, Harvey County today at 7, Butler has 16, Cowley County has 2, Sumner 3, and Reno 36 cases of COVID positive patients. In the Sedgwick County numbers of our 408 positive COVID cases, we've had 201 total recoveries, and in Sedgwick County, our total death number is 11 as of today. As we've talked about all week, the criteria for testing has been revised. Residents can be tested if they have at least 2 symptoms of COVID-19. There are no restrictions of age or underlying conditions. KDHE reports that as of noon today, May 1st, that more than 4,000 residents in Sedgwick County have been tested for COVID-19. The Sedgwick County Health Department has tested roughly 1/4 of those 4,000 people. The Health Department is currently taking samples of residents who meet the criteria to be tested for the disease at no cost to the residents. The Health Department will take samples of more than 90 residents today as they go through the drive-through site on West Central. Residents are still encouraged to call United Way of the Plains at 211 if they think they should be tested for COVID-19 if they're symptomatic in any way. Our current orders today, the governor, of course, released her new guidelines last night at 6:30 p.m., but her stay-at-home order is in place until May 3rd. If you look on the Sedgwick County website, www.sedgwickcounty.org, we now have on our website a link to the governor's order from last night. There is also a link for business recommendations for reopening. Those are the first 2 columns now on our website. And over the course of the next few days, between now and next Wednesday, county staff will be working and cleaning up the county plan, which will be in conjunction with the CDC plan, now that we have the state of Kansas plan, and now we will develop and further refine and implement our county plan, which will be in sync with all of those plans. So we will look forward to that. Staff will make a report out next Wednesday to the BOCC regarding that template and what that draft looks like, and it'll be a work in progress. And as has been mentioned several times by the governor and by the chairman of the commission today, this process is very fluid and can change depending on what happens in the environment. So with that, that ends our summary for today. We will be back Monday with an update on current numbers and any changes between now and then. Thank you.
Tom, it's Kim over at Channel 12.
Hi, Kim.
Are you guys getting peppered with a bunch of questions from individual businesses about how to interpret this, and what are you doing with those questions? Because at this point, obviously, there's, like you said, it's a work in progress, right?
Yeah, right. To answer their first question, Kim, yes, we're getting, as with any new order, whether it's state or county, there's always questions. So we're trying to answer those as best we can today. And the county is formulating a standard response to those types of questions, which will basically say, give them access to the governor's order. A lot of our questions today are from businesses of can I open or not? And we refer them back to the governor's order to look. There's a pretty clear and distinct list of who cannot open in phase 1. And if you're not on that list, then the answer is you can open, but there are sets of restrictions that you should try to follow as a best practice, which is why we include the link for those types of businesses. And it's pretty robust on the governor's site. guidelines that people can look for as they try to safely reopen. So that's how we're going to handle the questions en masse, is refer them back to the order and make sure that businesses know that they can open unless they're on the list of a half a dozen or 10 businesses that still under phase 1 cannot open, and then give them direction on how to find some guidelines on how to do so safely.
Can you hear me?
Yes, sir. Hi, Don.
Okay. This is Don from the Eagle. I had a couple of questions that spun off this morning's meeting. With the removal of the so-called snitch line from the county website, what are people supposed to do now if they see gathering that is in violation of the orders?
Well, what we're going to be looking at is options for to instruct people what to do. We'll report out on that next Wednesday. What we're telling people today is that we're no longer accepting those types of complaints about COVID violations, and we'll try to get something out early next week to give them direction. The commission, as you heard this morning, instructed staff to come back with some options, and it's everything from nothing to 911, and we'll come up with some maybe some middle ground there. But for now, I would think that we would ask them to hold the concerns, and we'll try to get them definition as early next week as we can.
Okay, so between now and next Wednesday, there's no place to report this.
I guess if they want to maybe contact the governor's office or commissioner's offices, we would still receive those complaints. But there is no hotline any longer.
Okay. Second, I had a question about the interpretation of the 10-person limitation.
Mm-hmm.
Is it the county's interpretation that a restaurant could seat 10 strangers at a table, and then at another table 6 feet away, 10 more strangers at another table 6 feet away until they run out of space?
Actually, Dion, the chairman's here with us today. Maybe I'll let him field that question because we actually had a pretty robust discussion this morning. Is that mic hot, Kanika? Chairman, you have to come over here. Hold on just a second, Diana. We'll tag team this.
You can.
Okay.
If you want to just do voice, you can do it here. Okay.
All right. So we're both on. Go ahead, Pete.
Dion, your 10 is correct. Strangers is probably incorrect. It's 10 known people can sit together, meaning family and friends, but they're not going to sit 2 people and then bring 6 others that don't even know each other and put them at the same table. So it's up to 10. It's up to 10 and more, or not more than 10.
Because there are restaurants in Wichita that operate on that business model of having long tables.
They should not be
groups.
I think there's language right in there that known parties. They have to know each other.
Okay.
So.
And I think that you'd mentioned that deaths, hospitalizations, and ICU admittances are going to be the factors that are looked at in determining how we're doing with this.
I think, Diane, we're going to try to come up with as many measurements for the commission and Dr. Menz to examine as we move forward as we can get that are germane to public health. So clearly, number of cases in relation to the amount of testing we're doing, because everybody understands that as we test more, we're going to get more positives. That's not necessarily a bad thing. It's a matter of fact, Dr. Menz said this morning that's a good thing. We can try to identify people before they spread the infection. That's one. Clearly, an important one is stress on hospitals, and we'll work with the hospitals to come up with some type of, as I think I explained it the other day, some type of red light, green light, yellow light area where if right now all lights are green there, they're in great shape. They've got space and capacity. If that changes to where it goes, maybe we're a little bit more cautious. Or if it becomes a crisis, we need to clearly get that back to the commission so they can make adjustments moving forward. So the hospital status is one, availability of PPEs, availability of testing. Those are all kinds of dynamics that we will give to the commissioners on a weekly basis, and we'll put it on our website so that any citizen can see it to make determinations and monitor how we go through the various phases of the governor's plan.
Okay. And one other question. There were two recommendations by Dr. Menz this morning, both of which were rejected by the commission. One was the playground equipment, and the other was buffet dining. My question was, can cities make restrictions that are more, can cities restrict those things, although the counties decided not to?
Well, first of all, on the two restrictions brought up by Dr. Menz, the buffet lunch issue is actually is in the governor's order specifically. So I think that they are, even by the governor's order at this time, prohibited. The playground issue, I think the answer to your second question of whether cities can come in, they can have ordinance applicable in a municipality as long as the health officer approves that, which Dr. Menz, by making that statement this morning, has said he thinks that that's best practice. So I think absolutely cities can adhere to that and also create ordinance for that. I don't know that the commission's not going to revisit some of those requests, or at least the playground request, but they opted not to take action on it today. But I don't think that prohibits the cities from doing that.
Thank you.
Any other questions? Thank you all. See you next week. Everybody have a good weekend.